Hello, my name is Darya. I'm making a presentation today on diphtheria. Diphtheria is caused by a pathogenic bacteria called Corynebacterium diphtheria. It's a gram-positive rod-shaped bacteria. Domain is bacteria, and class is Actinomycetia, and genus and species is Corynebacterium diphtheria. A little bit of history. Diphtheria bacillus was discovered by two German scientists in late 1800s, but it was well documented as a disease with special sign well before the discovery of its culprit. The bacteria itself is part of our normal microflora of the nose and pharynx, which are part of our upper respiratory system. Normally, it's a fairly harmless bacteria, but its virulence factor is taxonomic in nature, and some strains of this bacteria will become pathogenic due to the presence of bacteriophage, which is a type of virus. Virus is an infectious particle, and this infectious particle causes a lot of havoc. Is a phage. So it's an encoded protein that affects this bacteria in such a way that it starts to produce something that we call diphtheria toxin. And this diphtheria toxin is cytotoxic protein, which inhibits protein synthesis of the host cell by inactivating elongation factor of EF2. This produces a cascade effect on the host. First leads to the host cell death, and causes inflammation, which accumulates a lot of dead cells, fibrin, mucus, fluid, blood cells, and forms something that we call pseudomembrane. Typically, diphtheria is an infection of upper respiratory system, like in your throat, but it can cause lesions on the skin and be looking like impetigo. Diagnosis: typical symptoms would include sore throat, weakness, and general malaise. Some of the signs of diphtheria include fever, swollen glands, and this pseudomembrane that is seen. So this pseudomembrane is what brings most clinical concern because it is life-threatening. Should it become very thick, and it can obstruct an airway. Some patients have to be intubated for life-saving purposes until they can receive treatment and inflammation goes down enough for them to breathe on their own. Of course, sadly, some people have died from this infection. This brings us to diagnosis. The primary diagnosis are presumptive diagnosis and are based on the presence of the pseudomembrane, taken in a factor of the vaccination history of the patient also is important. However, more definitive diagnosis, of course, is a culture swab. Could be swab the throat or wound bed to just identify bacterial cultures. Treatment would include broad-spectrum antibiotics such as penicillin or as erythromycin. These are two different antibiotics. Unfortunately, antibiotics only kill the bacteria, but not the toxin. And the toxin is kind of what causes most damage to the host tissue. So antitoxins are advisable and recommended course of treatment for upper respiratory infections, but not so much for skin. Because they do cause a lot of hypersensitivity, allergic type of reactions, because they're actually made in a horse, but they're definitely necessary. Diphtheria is a communicable infection which spreads by aerosol droplets from person to person, and a person who's infected should be isolated for 48 hours after, while they're sick, but also after the start of treatment. Some of the complications include airway blockage, myocarditis, polyneuropathy, and kidney failure. Hopefully it doesn't get to that, but it's a pretty bad bacteria to get. Um, uh, Prevention is, of course, vaccination. We've all gotten it. I think by the age of 6, people get it. Kids get it like 6 times. There's different vaccines that are available. Usually they're a combination of tetanus and diphtheria vaccine. And mostly seen cases are above 25 because they didn't get their vaccine. These are my resources, and thank you for watching.